I should probably do the Zoom too. More people come live, then I'll take the appropriate precautions and stay 2 meters away. This one's gonna be easy for me because I gotta do nothing. I'm relying
like hard questions remotely.
like Brandon does. Oh my gosh!
Does he ask you hard questions?
Not hard questions, but like he'll ask me questions and like I know the answers to, but when I'm on the spot, I kind of freak out. Like practicums and stuff like that, clinical practicums. I'd get stressed.
It's stressful, yeah.
I'm not good under pressure.
I bet Brandon's like a tough question asker too. He'd be
Yeah.
asking about like biochemical pathways and like pain gating and stuff like that.
Yeah, Brandon expects the world. Hey guys, Sunny and Rob here practicing social distancing. So we are 2 meters apart. I will be in a limited capacity because I don't want to steal the show from Rob. Rob's got a lot of interesting things. I should probably shut the blinds because Zoom's a bit more tricky.
And today we're talking about running injuries.
Yeah. What about jokes? Any jokes, Rob?
I didn't bring any new jokes today.
I've heard a couple of jokes, but they're inappropriate, so I don't want to share them.
That's really nice.
Sorry?
Lighting's really nice.
Lighting is perfect in here. Paid enough money for it. All right, so still waiting for some people to attend here. I don't know if Steven's going to be coming, but hello.
People probably see my face on here and just assume that I'm going to crash Instagram again.
Oh gosh, I don't know. I've been promoting this. It takes a few minutes to get people in. We got exciting talk, running rehab today.
I'll reuse my dad joke from last week in case anyone is like new on here.
Yeah.
What's the difference between a large table in a restaurant of guests and a runner?
I don't know.
Large groups in restaurants split their checks. Runners check their splits.
Oh,
Like their split times.
that's a good one. That's a very good one.
Yep.
Okay. I'm trying to look, but I think we used. I'll call you later. Don't call me later. Call me dad. That's a pretty good one. What else do we got? I would avoid sushi if I was you. It's a little fishy. You know, that's not my best work. That's not even my work. Why do melons have weddings? Because they can't elope. Can't elope.
I like it.
Very nice. Have you been keeping active,
Me?
Rob? Yes.
I biked here today. It was good.
Mm-hmm.
Yeah. Got the bikes tuned up yesterday.
Oh, got them tuned up? Did you do it yourself?
A little bit of grease and stuff like that.
Yeah.
They're not perfect, but they seem functional. That's what I aim for.
Cool.
I'm not proficient, but I'm persistent.
Very good. Very good. You tuned them up yourself though, eh?
Yeah, mostly cleaning and then
Yeah.
just cleaning the chains and a little bit of lubricant.
Okay, cool.
Straighten cement this fender.
Very nice.
Yeah.
Straighten the fender. What did
Straighten
you
the
do?
fender.
Bail on it or something like that?
It was, I don't know what happened to it. It just ended up
Sonia
crooked.
Gill. Hey Sonia, how's it going? Sorry. I get excited when I see people on this. We'll give it a few minutes, guys. We are practicing social distancing, so
If
yeah.
anyone has like running questions though, you can post them right now, and then I can make sure that I'm hitting them as we go through.
Yeah, we'll hit the stride of questions. Oh.
Once this presentation like hits its stride, yeah.
Yeah.
Same jokes.
Oh, you're trying to make it better now.
Yeah, it was good though.
We are the adequate distance apart, so Rob is here to talk about running. Give me 1 second, guys. I've heard. Rob, continue, Rob. How's it going?
Yeah, like I said, if anyone has any like running questions or anything like that, go ahead and throw them up on the Instagram comments there. And yeah, we'll kind of hit them as we flow through today. And if anyone out there is a runner, maybe just go ahead and post like, I don't know, what your preferred distance is, or maybe some of your goals for this spring, anything like that, just so we sort of know who we're talking to here. I know we typically have like a few like physiotherapy students and like physiotherapists on here too, so yeah. So in today's talk, we'll kind of go over some stuff that's usable for like runners themselves, and we'll also touch a little bit on like what we can do as clinicians to get people back on the road. Someone just posted, why is running more than 10 minutes so terrible for me? That's a great question. And yeah, we'll talk a little bit about kind of progressing loads as we go too, but yeah, everyone's different basically. Like your like kind of your elite competition runners are going to be doing like oftentimes like well over 100 kilometers a week, and for beginner runners, often even starting around 3 kilometers a week is kind of a good idea. So that might be you if you're more in the kind of 10-minute limitation group, and then you're just going to want to progress comfortably from there. But I think running is like, it's one of those things, it's like the more you do it, the more enjoyable it becomes. So it kind of becomes that kind of that positive spiral. You run a little more, you feel a little bit more comfortable with your running, and it becomes like more and more rewarding as you go. So even if it feels terrible now, I think in most cases, persist. Or there's like biking too. Well, we've got a good number of people in here right now, so maybe I'll get things rolling. And like I've said, if anyone has any questions like as we go along, I'm not terribly proficient on the technology, but I'll try my best to sort of keep an eye on the messenger board there. And if anything pops up, we'll try to answer any questions as we go along. And then we'll try to leave some time at the end to try to get through the material here like in a timely fashion. And so basically what we want to talk about today is running injuries. So we'll kind of briefly discuss like what a running injury is generally, and then in the context of the presentation today. The next big question is like, can we do anything to mitigate our risk of developing a running injury? Or can we do anything for maybe a runner who comes in with an injury? Or if you are a runner with an injury, are there things you can do to get back up to speed as quickly as possible? And then finally, we'll kind of talk about if we can make those changes, like what kind of changes are those, and what are a few different ways of adopting those into our training programs. So one interesting thing about running injuries is simply that they've just been defined differently by different studies over the years. So yeah, basically an author might choose to look at, for example, runners who present to the emergency department. That's gonna like more likely be your more acute injuries. That could be like a bad ankle sprain. Maybe you slip on some rocks and skin your knee, or land and break your wrist, that kind of thing. Maybe you're out running, you get hit by a car. So that author might choose to define running injuries that way. Yeah, other authors might choose to define running injuries as being overuse injuries. So injuries that occur sort of like as a result of your like running load and mechanics over time. And those authors might choose to exclude the more acute stuff like an ankle sprain or wrist fracture. So depending what you're reading, you'll get different sort of incident rates of injury over time, which makes it like hard to compare from one study to the next. And it also makes it hard to sort of like track injury trends over time, right? Like running became popular like back in the 70s, and footwear, or even earlier than that, and footwear was a lot different then. Your average runner was a lot different then. There's more kind of entry-level recreational runners nowadays, from what I understand. Whereas back in the day, it was more of a, most people who were running were doing it basically competitively.
Yeah, I'd be the entry level one. This is Sunny, by the way. I'm here. If Rob's looking in this direction, it's
Sunny
to
came
me,
back.
and I'm keeping my distance from him. I do trust him and do love him, but I want to keep him safe.
Yeah, keep
Even
our
though-
germs separated.
Even though I interact with absolutely nobody every day, but sorry. Entry level, that's me.
So yeah, we got kind of the whole spectrum these days. Lots of people getting into running, which is a fantastic thing. But newer runners are more injury prone than those who have been running for a while, for reasons that we'll discuss. So anyways, the bottom line is injury trends over time are hard to track. Lots of people have kind of like said that injury trends have been pretty steady over time, which is interesting because we've had big, seemingly big advances in footwear. Like if you compare what people are wearing nowadays, what they were wearing 40 years ago or 80 years ago, you would think that with all this new technology, we would be kind of getting running injuries under control or have them figured out, or with like fancy gait analysis and stuff like that, we'd be able to like put everyone into a shoe that would prevent injury. But obviously not quite the case.
Do you think a lot of people are like more competitive nowadays with more people running?
It's a good question, yeah.
It seems like you see a lot of people do these like half marathons and post on like social media and stuff, and getting, which is great because people are active, but
it's true, yeah.
I think it could lead people to maybe like overdo it to a certain extent.
I think totally, yeah. Like, I don't know, some things I've read have recommended for a beginner runner not to exceed even like 3 kilometers in your first week.
Oh,
which is like
okay.
3 kilometers, that's like very, very small, right?
Even I can say that's a piece of cake, Rob.
Exactly, yeah. So some authors have even said that exceeding 3 kilometers for a brand new runner is going to be kind of increasing your injury risk. So totally, yeah. Like when you see people online who are doing like half marathons or marathons like within their first year running, that's fantastic. But not everyone is going to progress that quickly. So I think it's important to kind of listen to your body when you're kind of building up your volume. And then like ultra marathons and stuff like that are like popular now too, right?
Oh yeah.
Like it used to be crazy if you ran a marathon, but now I don't know. I see people all the time who are doing like ultras and like multiple ultras, and
I can't believe it.
and
Like what the human body can do. Like endurance sports to me like seem, I don't want to use the word crazy, but like just unattainable than like other sports and stuff like that, because I'm not a big
it's all
big time
perspective,
runner.
right?
Yeah.
Like you could lift a house, and that seems like very out there for me versus the endurance stuff. So
yeah,
yeah.
I like the short bursts of power because then I could sit down for a minute or two.
So you might be like a sprint interval guy then.
I'd say so, yeah. Let's call me that.
That's right, yeah, exactly. Anyways, so so I talked a little bit, so footwear over time has changed quite a bit. Injury rates like may have, they may not have, it's like hard to know for sure. If anyone knows, I don't know. I think it's hard to say, but in studies where they've put people in different footwear, injury rates have been different. So it's not that footwear doesn't make a difference at all, like at least according to those studies, it seems to. I won't get too much into footwear unless anyone has questions on footwear. But my philosophy on footwear is you want like a lighter shoe. If you just think about like the mechanics, like the absolute weight between a heavier and lighter shoe might be like small if you like compare it to the weight of your leg, for example. But since it's working at the end of a very long lever arm, like it does make kind of a difference for efficiency. Like if you're holding like 2 pounds out here versus 3 pounds, like you feel the difference. Even though you may not if you were doing like a shoulder press. Anyways, long lever arm,
but
more
then
movement of inertia. And
that's like endurance, so it's done repetitively over a long period of time, so it adds up.
Totally, that's right, exactly. Even if it's a few ounces, like if you're doing that 40,000 times over the course of a marathon, like it's gonna, it all adds up anyways. Footwear, like my philosophy, like keep it lighter if possible. It doesn't need to be an expensive shoe, but you want to find a shoe that's as comfortable as possible. And research has sort of shown that too, like, even versus like kind of mapping your gait and like foot strike pattern, that kind of stuff, that's probably all important too. But the shoe that's the most comfortable is probably going to give you the least likelihood of becoming injured. So that seems like too simple to be true, which is why I love it, and it's so intuitive. So if you're out shopping for shoes, like try a few on, run around the store a little bit. The one that feels the best for you probably is the best for you.
I've heard lots of like friends go to specialty shops and get fitted, like not even like custom fitted, but they would just study their running patterns and their foot and then say, hey, the Nike whatever is the best, or the Adidas whatever is best for you. And I had a friend who was told to wear, I don't know what brand it was, but she was told to wear this particular shoe, and like her pain just got worse and worse. Like it was uncomfortable to use from the beginning, and the guy, whoever sold them, said, no, you need to work them in. That's a good point you mentioned, just keep it comfortable.
Yeah, it seems
your body knows what's the best for
exactly, yeah. That only makes sense, right? Like,
yeah.
We've probably been evolving for tens of thousands of years to run. So I don't know, maybe we don't need all that much extra. Anyways, that's my shoe wear philosophy. If anyone has footwear questions,
Rob loves shoes.
I'll go off on more tangents.
My goal is to get him many pairs of shoes in the future.
That's right, yeah. Well, and even okay, one more thing on shoes. Even rotating footwear, so having a few different pairs of shoes that you like and changing them up has been shown to reduce injury risk too. So since I've been running more, since the socialization and not working regularly, that kind of thing, I've been rotating a couple pairs of shoes, and that's worked well for me.
Okay, so what are your thoughts on customizing insoles from a podiatrist versus regular running shoes insoles?
Yeah,
so you're using podiatrist,
That's probably a contentious thing to get into because it's a whole profession, right?
Yeah.
So I don't want to say anything to get myself in trouble. But
I think.
Oh, sorry.
No, you can go ahead. I don't want to interrupt you.
Yeah.
Right?
Well, I was just gonna say lots of what I've read has found that off the shelf stuff is comparable with custom fitted. That's not to say that no one could benefit from that, because I'm sure there's cases. But and again, the same study I was talking about that put people. So basically, you come into the study, you're offered 6 pairs of footwear. I don't remember the exact number. You try them all on for a couple minutes, and you select the one that's most comfortable for you.
Yeah.
Then you get randomized. So you might get the shoe that you picked, or you might get a different shoe.
Okay.
And people who got the shoe that they picked as most comfortable had the lowest injury rates.
Yeah.
And people who were put in a random shoe had higher injury rates. So that's kind of where that came from. Yeah. And they did the same thing with off-the-shelf orthotics. Yeah. So they'd give you the choice of a few orthotics. You pick the one that's most comfortable. And again, you had a lower injury rate with that. So similar concept, I guess. If it's comfortable, it's probably good. If it's uncomfortable, it's probably bad.
And I think to add to that, if you have insoles for a medical condition, then yes, sure, use those in your running footwear. I know some people with heel spurs, flat arches to the point where it's causing an issue, then yes, you need to wear your insoles in whatever kind of running shoe. I know there are orthotics. I can't say I used to make them because I didn't physically make them, but I used to measure patients for it and using force plates and things like that. And as long as the insole itself is meant for abuse, there was different ones we had for different levels of activity. So they're obviously the most expensive one was the one that's it doesn't start stinking after a couple of days, easy to wash and clean and stuff like that. So I think if you have a diagnosed issue, you have flat feet, for instance, and to a certain extent, I have flat feet, but they don't cause issues. But if you have flat feet and it's painful and you've been recommended to wear insoles, then yes, use them in your running shoes.
Yeah.
I think that answers that question.
Yeah, and flat feet's a good example of that. And like you said, some people have flat feet, but they never run into any issues at all. Even some world record runners have quite flat feet. Yeah. But yeah, exactly. If you have flat feet and you have symptoms that are tied to that, and you get relief with an insole, that's fantastic. Yeah. Then
there is a time and place for insoles, and this is a good answer to not step on toes.
Exactly. It's like that. And even there's some examples of injuries where and we'll talk a little bit about kind of training loads later on and how we can modify that. But there's some examples of injuries where you want to kind of change the gait a little bit in the short term to give a certain tissue a chance to rest. Mm-hmm. So if we take one example of an Achilles tendonitis, the Achilles in the running cycle is under the most tension just before the heel lifts off. So when the foot's kind of maximally dorsiflexed or the toes are kind of nearest the shin. And by putting a little bit of support underneath the heel, whether it's a little heel lift in the shoe or a shoe with a little bit of a more built up heel, it just decreases that kind of peak dorsiflexion angle. So that can be something that's good for Achilles tendonitis, and that can just be in the short term. You might do that for the 2 or 3 months while you build back up to your normal training loads, and then you might choose to kind of wean away from that if you find you don't need it anymore. But that's an example of where you might bring something in for the short term,
Yeah.
and then
Wean off of it.
wean off of it. Over
That makes
time.
sense. I know I do that with people who squat. I get their heels lifted a bit if they have bad ankle mobility, and then slowly reduce the height of it. So
Totally, yeah.
it's kind of cool that running shoes are like that too.
And when I like upped my volume, like whatever it was a month ago,
Yeah.
that's what I ended up with, was a little bit of like a right Achilles that was like a little unhappy.
Mhm.
So I'd been using like a zero drop shoe, which has quite a low heel in it for a long time. So when that happened, I switched back to an older pair of shoes that I have with more build up under the heel, and it was pretty instantly gone.
Wow.
And now I'm just going back and forth and like doing alternate runs in the two different shoes,
Yeah.
and no issues so far. So, but same thing. But if another option there, if I didn't have the shoe with the higher heel, could have been to put like a small heel insert in my existing pair,
Yeah.
and that would have been like another thing to try out anyways with the Achilles.
No, it's good. And ask questions as we go, guys. So great question, and it flows well with the discussion. So
Exactly, yeah. Okay, I'm gonna bring out one of my charts here just really quickly.
yes, I
Um,
love these.
I can probably just hold it up here, okay? So, this is my unlabeled graph right here. So on our horizontal axis, you're gonna be your training volume. So this is like no training volume, like totally resting. This is kind of a moderate training volume. That's gonna depend on the person. And then this is gonna be like a higher volume. And again, that'll be person dependent. So for example, and then, sorry, our vertical axis is going to be our risk of injury. So if we take like maybe myself, maybe I'm doing like maybe 20 kilometers a week on average. So for me, that's going to be kind of this sweet spot right here. So this is going to be, I'm working kind of an average amount for me. I'm not necessarily kind of like building up my tissue, but it's not breaking down either. I'm kind of at that nice homeostasis point. If I go on like a month-long vacation and I'm sitting on my butt the whole month, that's going to put me down here. So I'm like low activity. And with low activity, my tissues are going to get like deconditioned pretty quickly. So they're going to get like a little bit softer, a little bit more sensitive. And then if I were to try going for a run, I'd have a higher chance of getting injured. So there's going to be some deconditioning that happens at the low end of the activity scale. If we go up to the high end of the activity scale, so maybe I go from my 20 kilometers a week up to 50 kilometers a week, and like I'm using distance as an example because it's easily quantifiable, but maybe I switch from 20 kilometers on the road to 20K on the trail, or maybe I'm doing 20K on the road and then I add in like a 20K bike ride. That's going to increase my volume there too. Or maybe I switch to a route with more hills. So distance is kind of an easy example, but there's different things as well that can kind of bring you to the high end of the training volume curve. And if I go too hard too fast, which is what this zone here on the chart represents, again, higher injury risk. The other rectangle here is going to be kind of that sweet spot where you're pushing a little bit beyond your normal limits. This is going to allow for kind of like an adaptive homeostasis where tissue it's being overloaded, but it's having a chance to keep up. So tissues are getting stronger, more resilient, but you're not pushing it so hard as to cause like excessive tissue breakdown. So this would be kind of like where you want to be if you're trying to push your goals a little bit. Anyways,
Cool.
that's a curve right there.
We do have a question from Heavy Evie, one of the owners of Farm Strong Athletics, who joined us yesterday.
nice, okay.
Great discussion. Did your higher heels help you land more on your forefoot when you ran?
Great question. That's so good.
Yeah.
So anyways, I'll wrap up training volume really quick.
Sorry.
That's okay. That gets into my next thing really nicely. So basically, like, you're gonna have a certain tissue capacity. That's gonna be it's gonna be based on a lot of things like genetics, tissue health, training history, all those kinds of things. Then you're gonna have the amount of activity that you're doing. So if they're basically matched, you're gonna be in that kind of low injury risk part of the curve where you have that nice homeostasis and probably no injuries. If you start to like kind of increase your training a little bit, you can push it a bit and your capacity is going to be able to keep up and you'll be able to gradually increase that capacity over time. If you push it too hard too fast, that's where you're going to have like breakdown. So basically your tissues can't keep up with the load that you're applying to them. So instead of getting stronger, you're going to run into issues. So that could be like a tendonitis, stress fracture, patellofemoral pain syndrome. Like there's all kinds of examples. Basically, like the running injuries we're talking about will happen if your load exceeds your tissue capacity. Likewise, if we kind of think of that like beach vacation end of the of the stress curve. If we're too low with our activity, then our tissue resiliency is going to start to come down.
Yeah.
So that's basically like the foundation for like why running injuries happen, is that you're pushing your load too high, your tissues can't keep up, so something's going to break in the chain. Where like the biomechanics come in, which is what we're going to get to next here, is going to be sort of the weak point in the chain where things go wrong. So things like foot strike can change the injury risks for different injuries. We'll kind of start with that because that's kind of where the question leads us. And then there's a couple other different kind of like biomechanical things that are, I won't say like easy fixes because nothing's like an easy fix, but there's a couple sweet spots, I guess, and if we hit those, we can like prevent or help with a lot of running injuries that happen.
Mm-hmm.
So yeah, foot strike is like that's been such a hot topic lately too.
Yeah.
I know like Christopher McDougall wrote a book called Born to Run. I'm not sure how long ago, a little while ago.
Yeah.
But it was all about lots of like barefoot running.
Yeah.
Basically like kind of vilified the heel strike, and his philosophy at the time, if I recall, was like the forefoot strike is more natural. If you're running barefoot, you're probably not heel striking.
Yeah.
So it's probably like more cushioned footwear that sort of allowed that heel strike, starting in like whatever the 70s or whatever with Nike. And so I don't know, I think there was some blame there for like current running injuries being kind of the result of heel striking. So because of that, a lot of people tried like kind of shifting to that like forefoot strike pattern where you're landing more on your toes, or people have asked questions too about like a midfoot strike, which is kind of that like in between where you're kind of landing in the middle of the foot, like the name suggests. It's not quite toe, not quite heel, but in between. Importantly, for like any of those patterns, you're probably landing a little bit more on the lateral edge of your foot. It's kind of a typical gait pattern, and then sort of like rolling and pronating as you push off. But anyways, heel strike, midfoot, or forefoot strike. Lots of studies have been done since then, both examining like injury rates in forefoot strikers versus heel foot strikers, or studies trying to like change people by like either a lot of different techniques, try to get them to go from a heel strike to a forefoot strike. Yeah. And like basically like what they found is that injury risk is like basically the same. Like you don't decrease your risk by switching, and people who forefoot strike versus heel strikers have about the same injury risk. But the two are like very different. So they do load kind of the lower extremity quite differently. So if we take kind of that heel strike example first, it's going to produce like a little bit more of a load through the knee and the hip, like kind of a more joint impact in a way, I guess, in the knee and the hip. So you're going to have like maybe a higher incidence of like patellofemoral pain syndrome, or like greater trochanteric pain issues, those kinds of things. Whereas the forefoot strike, it loads kind of the like plantar fascia, Achilles, calf, kind of that like posterior chain on the leg quite a bit, which makes sense. Like when you're forefoot running, you're basically bouncing on your toes the whole time. So if you even just like put running shoes on and just like bounce on your toes for an hour, or even half an hour, like whatever your kind of typical run is, you can imagine that you'd have like quite the calf burn by like 30 minutes, right? Yeah. That's like a lot of reps. We give people like 30 calf raises to do. That would be like, I don't even know, 900 or something within half an hour. If you do one every couple seconds.
Some solid calves.
Anyways, yeah, if you think about like a toe run as being like 900 calf raises over 30 minutes, you can imagine there's like a lot of like kind of that posterior chain load. So even though injury like rates might be similar, you're going to tend to have more like maybe like some plantar fascia issues, or like Achilles pain, or calf tightness if you switch to a forefoot strike. So I read this book like 5 years ago or something like that. So of course I was like, yeah, I'm going to switch and be a forefoot runner. Yeah. So I spent a couple months like kind of like easing into it, and I had like exquisitely tender calves like the whole summer. And now I've kind of switched back. They're exquisitely tender.
I like that the usage of that word. Yeah.
Like eyes watering. But yeah. Anyways, what was the question again?
It was just, did your higher heel help you land more on your forefoot when you ran?
Okay, so yeah. Anyways, this is a very roundabout answer. So basically, around the same time, I was trying to again kind of get more onto my forefoot and less of a pronounced heel strike. So that's when I switched to a low drop shoe with less heel. The idea being that if there's like say a half centimeter less under your heel, you're gonna tend to like land more on the forefoot because you're gonna kind of like bypass the heel during your gait.
Yeah.
And it might be like hard to picture, but like you can kind of imagine that if you have like a bigger heel, then it's gonna be easier to land on that as you sort of come through.
Yeah.
Yeah. So, anyways, yeah, I haven't made any like conscious kind of footfall landing pattern changes this summer with the footwear change. What's a lot more important, so that answers the question anyways. So sometimes more of a built-up heel can lead to like a more pronounced heel strike.
Yeah.
Yeah, if anything, but there's probably not like a huge change in your gait with just making the footwear change.
Yeah.
But yeah, if anything, maybe like a little bit of that. But what matters a lot more for like your foot strike isn't necessarily like how the foot lands, heel versus mid strike versus toe, but it does matter a ton like where the foot lands with respect to your center of mass. So anyways, we talked about like what running injuries are, can we modify them with kind of like gait changes, footwear, etc. Yes, we can. Now we'll kind of get into that third part, which is like what changes can we make to like to address running injuries, I guess, or at risk of running injuries. And the first big thing is called overstride. So basically, what overstride is going to be when you land with your heel further out in front of your body, rather than landing with the heel directly under your body. Can we swing the camera around and look at a couple pictures on the iPad here?
I could do that.
I'll do this.
I can, yeah, I can just take it all and
Sure.
do it for you if you like, while I stay far away from
Oh
you.
yeah, that looks pretty good. Okay,
It's not too
so
bad, but the only thing is the computer.
oh yeah,
We might have to kind of do it twice.
I can describe what I'm looking at here too for the people on Zoom. Anyways, this picture here, so the kind of the middle of the hip, that's often used as sort of an approximation for where your center of mass is. And like one thing, this is just pulled up from YouTube, but one thing they're looking at here is like where the foot's landing with respect to that center of mass. So from the hip, they have the straight vertical line, and then you can kind of easily see like where the foot's landing, like with respect to that vertical line. So for almost anyone, it's going to fall slightly ahead, but overstride is going to happen when the foot is further out. So I want to show a little video here too. So this is Eliud Kipchoge from Kenya, and he was the first man to run a marathon in under 2 hours just this past fall. Hold on. We'll try to catch him he's so fast, it's impossible to get his foot strike. Anyways, yeah, so it was not an official world record because it was not kind of an unassisted marathon. It was kind of neat conditions though. So he had, it looks like 5 pacers out in front of him and they rotated, and a couple pacers in behind acting as a windbreak. He was driving behind like a Tesla, an electric car with like a laser pointer on the back. So this green line that you see here is, that's keeping his like 2 hour pace. So his pace setters have to run exactly on that green line, and then he just has to keep up with the pace setters, so he doesn't have to worry about like his splits or anything like that. But I think for an official marathon record, you're not allowed to use those kinds of like technological things. And I think you aren't allowed to rotate your pacers either. So not an official, but anyways, but he did run under 2 hours, which is pretty incredible. So I was reading up on him a little bit, and this kind of like ties into the whole like overstride thing. Obviously, we're not critiquing his running mechanics because he's like the fastest man on the planet. But I was comparing like his stride with my own stride, just using my like kind of my Garmin device, and so like steps per minute, like I'm around 170, which might be pretty average, and he's 190. You'd expect him to be above average, and he is. But stride length, so I'm about 5'11", and my stride is about it was 1.19 meters according to my Garmin watch, and he's just under 5'5". And his stride is over 1.9 meters. So like his stride is like twice as long as mine, even for a guy who's like a full 6 inches shorter.
Yeah.
So I think we used to talk about people overstriding as in like taking too long of steps, but if you compare this guy with myself, he is by far the superior runner by leaps and bounds, and his stride is quite a bit longer. So it's not simply a matter of stride length in that sense, but yeah, with overstriding or overreaching, what's more important is kind of that foot landing out in front of the body. So you can kind of see like him, and this is kind of like a side angle, so it's not perfect, and his foot's not hitting the ground yet. But if you were to like really break it down and measure angles and look at center of mass, his foot's not landing too far out in front of his body, but he has a large stride behind his body. And then since he's moving at such a great speed, he's going to have like, even if his float time is similar to a slower runner, he's going to cover more ground while he's in the air, which explains his very long stride length. So it's not the length of the stride that's maybe examinable as a risk factor, but we're looking at that overreach where the foot's coming out in front of the body more. So let's keep that there for a second. And we can kind of like see here.
Maybe
Oh, sure, yeah.
I'll rotate this so we can
Oh, yeah, good idea.
show the Zoom peeps as well.
Here we go. So our guy at this end, so this is my right-hand side. I know that like it gets flipped around, but so he's landing with that foot out in front of his body. And I'm not a physicist or anything, but if we kind of look at the angle of the tibia and then sort of the ground reaction force, so kind of that equal opposite force that the earth is exerting on a runner as your foot is exerting force on the earth. That's important because we need to have kind of that upward push to keep our center of mass up. Otherwise, we're going to be on our bellies. And we also need to have kind of a forward propulsive force to keep us moving. People who overstride, overreach, which is this guy here, landing with the foot out in front of his body, if we kind of take that ground reaction force vector, it has like a large vertical component, and then it also has a component that's going kind of back this way. So people who kind of reach too far with that foot at landing, they're going to have more braking forces. So while the foot's out in front of the body, the ground reaction force is going to be decelerating them, and then as the foot comes through, they're going to have to kind of impart a larger acceleration to maintain the running speed, which you can kind of imagine is like less efficient. Like traffic, if you're stop and start all the time, you're going to burn a lot more gas than if you're cruising along at like kind of a comfortable, steady velocity. So with overstride, you're going to get more braking forces, which also means like more forces up through the joints in the lower extremity, which will increase your chances of like knee, hip issues. And then also with that kind of large vertical force, you're going to see people doing a lot of like vertical oscillation. So if you're watching a runner, like look to see where their heel's landing with respect to their hips, and also look to see if they're bouncing quite a bit. And if they are, there's a good chance that again they're sort of overreaching with that landing foot. So that oscillation again just indicates that they have a lot more forces coming through the legs. If again, like I don't know, physics-wise, if I'm kind of oscillating 2 or 3 inches, like again 40,000 times over a marathon, like it's like 120,000 inches.
Yeah.
Like that's, if you kind of like make that into feet or whatever, you can kind of imagine the extra work that you're doing to kind of like, I don't know, push yourself up each time. Gravity's going to bring you back down. You're doing a lot of work that you don't need to do. So by kind of decreasing that forward reach, you're also going to make your run a lot more efficient, both for the kind of start-stopping forces and for the kind of vertical oscillation forces too. So the first thing is that overstride. There's different ways of thinking of correcting that. I'll tell runners that if you're running and you see your toes coming up in front of you as you run, just try to make it so you can't. So that'll mean taking like a shorter stride forward, so you can't see your toes. That can be an easy cue for some people. Something as easy as increasing your cadence by 5 or 10%. So that just means kind of increasing like your turnover speed, more steps per minute. That just gives you like less time to overstride. So if you can, like a treadmill is great for this, and if you have something like I have an app on my phone, it's just a free metronome. All you have to do, record yourself running for a minute or two, take like a 1 minute segment, count your number of strides, try adding like 3 to 5%, so multiply by 1.03 to 1.05. That's going to be your target cadence. Set your phone's metronome to that speed, set it up, turn it on, and when you start running, keep your speed the same as you had before, so you're not just running faster, but you'll be taking like a larger number of shorter steps to maintain the same speed. That's going to tend to correct like both your overreach, your overstride, and it's also going to tend to kind of give you better kind of like frontal kind of mechanics from the hips to in like the next thing we'll talk about. So yeah, something as easy as that. It's pretty straightforward to implement, and it can correct basically everything, increasing your cadence by a little bit. If you're having issues, yeah, not everyone needs to increase their cadence. There are some targets that some people will talk about, like 170 or 180 steps per minute. But yeah, if you're not having issues, it's something you can play with, but not to obsess over. But if you are running into running injuries, that can be one thing to look at, especially if you find that you're kind of maybe one of these overreachers with your stride, or if you have kind of a bouncy run, try to decrease your bounce a little bit.
Yeah.
Yeah.
Don't want to be too bouncy.
Exactly. Yeah. Yeah. Another way that you can kind of improve your gait mechanics, and this is maybe like a more interesting one, is kind of work a little bit of barefoot running into your training. So barefoot running, probably not practical for everybody. I wouldn't run down the sidewalk without shoes on, because there's gravel right now too, right?
Yeah.
You'd be chewed up. You wouldn't last very long.
You'd have some bloody feet.
Exactly. Yeah. But if you have maybe you have like a yard, or there's like a park close by, and you can kind of like check the grass out, and there's nothing scary to step on in there, and you have kind of a good little route mapped out, you can like practice a little bit of barefoot running on the grass. Not your full run duration, but just a few minutes here and there, and kind of like take note about like how your foot falls, because without shoes on, you're probably not going to be landing on your heel as much. You'll probably like automatically switch more to like kind of maybe like a mid-foot strike, and then more importantly, you'll probably not sort of overreach with your foot as much, because you're just going to feel a little bit more impact if you do. You could even do this on a treadmill. Like set the speed low, don't go too crazy, and just kind of think about that. I don't know. I don't want to say natural, but like natural shoeless running pattern. And then again, this is just kind of a supplement to your training, and then see if you can kind of incorporate those gait changes like a little bit back into your normal runs with footwear, like wherever you run, whether it's like roads or trails. So just something to kind of like play with there for mechanics too. And that's also like a good foot strengthening drill, is doing a little bit of barefoot running. There's like legends about people with flat feet who have done barefoot running and like reduce their shoe size by 2 or 3 sizes. If you don't want to do that, you have to replace all your shoes, right?
That'd be too, yeah. Forget the pain that it would cause.
Yeah, there are legends though. Alan Webb, I think, was like a mile runner for the States. I think he set like a US record in 2007 or something, like under 4 minutes, of course for the mile at 3 something. And he had like famously flat feet. And yeah, the legend is that he started doing barefoot walking and running drills and decreased his shoe size by 3 sizes. But again, don't quote me on that. This is like running lore. Yeah. But that's a lot though. But anyways.
Running lore.
Yeah. Just put some lore into that. Yeah, so anyways, so mechanics. So overstride is one thing that we're looking at. Really important to note, like everyone's gonna look different when they run, and that's okay. We're not trying to kind of make everyone look the same with their running, which is why we're just focusing on a couple things that kind of have the biggest bang for their buck. You can make it as complicated as you want. I like to keep it a bit more simple, just get good at doing a few things, and I think you'll be able to help more people that way. I mean, it's possible you can video someone with like a high-speed camera. You can break down joint angles at the like trunk lean, hip, knee, ankle from different planes. And if you look in the literature, there are things in there that you can kind of like pick out and try to modify to change injury risk. But it's time consuming. It may not be like as meaningful for your athlete. Like for example, if you have maybe too much knee flexion initial contact, like what are you gonna do about that? It's not straightforward, especially if you're not seeing like a ton of runners in your practice, or if you're like a runner yourself, then like how do you maybe implement those changes? And there's also like issues there with like reliability. So if you were to measure the same person's angles like day in and day out, like are you consistent with your measurements? And some people would say probably not, which just means that it's probably not as meaningful. But yeah, different running patterns. If anyone can like pull up a YouTube video of Terry Fox running, like he has kind of that like run, double hop, like run on his prosthetic leg, right? Which you would never like coach an athlete to run that way. But he ran like marathon, he ran like 42 kilometers a day on average for like, I had to write it down, 143 days.
That's unreal.
Can you imagine? I ran a marathon and like, I'm out for, I can't like run for a couple of weeks afterwards.
Yeah, you're eating chocolate bars after and just.
Exactly, yeah.
I can't believe that many. How many days?
143.
So it's 143 marathons
in a row. That's like his average distance a day, 42 kilometers a day.
That person was
For
unbelievable.
143
like that
days.
much. And then the pain associated
And
with
again,
prosthetic.
like, yeah, like it's, yeah, I have the, yeah, anyways, very like atypical gait pattern, right? Because of his prosthesis. You would never tell someone to run that way, but he's a better runner than any of us. So like, what can you say, right?
Yeah, he'd go down for the best of all time.
Yeah,
With
no
that
kidding.
kind of
So,
track record.
yeah, pretty incredible endurance, like, and it wasn't like a running injury that stopped him, right? Like,
No.
unfortunately it was something different, but anyways, so yeah, if I could do something to run 143 marathons in a row, I'd do that too. But
Yeah.
anyways, and my point was, there's different running patterns for each person. Yours might not look like our 2-hour marathoner. It probably doesn't. If it does, good for you. But if it doesn't, that's probably okay too. There's all different kinds. There's a Chinese runner named Sun Yingji, who set like a female Asian marathon record in 2003, and she was like famous at the time because she ran with her arms like right at her sides,
Really?
like no arm swing at all. I couldn't find a video of her. I found some pictures, but yeah, basically like none of your typical arm swing. I think she believed it to be more efficient not to use the arms. And
Well, it's drag or
again, like you wouldn't tell someone to run that way, but she was like setting records in 2003, and I think she tested positive for doping.
Oh, there you go. Because yeah, you think you need the arm swing, right? Like
You would think so, totally, yeah. Yeah, and then I think like her teammate said that she had like maybe put something in her drink or something. I think she got banned for a couple of years, and when she came back, she was never quite the same.
No.
Like, quite the story, anyways.
That's quite you got
But
lots of good stories.
Yeah. And yeah, like one thing I heard, like when they were trying to, because Nike kind of arranged the 2-hour marathon thing, I think one thing they tried with their athletes was to have them run with their arms at their sides. Again, on the theory that it was more like efficient. But from what I understand, the athletes hated it, so they didn't keep up with it. But
Yeah.
anyways.
We got a comment of all your interesting stories. We got super interesting info about Terry Fox and his running! Exclamation point.
Yeah. So again, like
Very
if
good.
someone's trying to like, I don't know, maybe pick apart very like minute differences in your running mechanics, like that's just something to keep in mind. Like
Yeah.
the guy, like his running was very, very unique to him, and he managed to run uninjured for half a year doing a marathon every day. So yeah, again, I wouldn't try to emulate that running technique if you don't have to, but it just goes to show that everyone's going to look different running, and that's probably okay. Yeah, anyways, getting kind of back to my framework, we talked about what running injuries are, we talked about can we do anything about them, we can, and what can we do about it, we talked about that overstride, correcting that, fantastic. The second thing that's relatively easy to look at as far as like biomechanics go is going to be what we call the knee window. So knee window, basically, if these are my legs, if I'm running straight forward, they're going to look sort of like this, and there's going to be a little bit of space between my knees at any given point in my gait cycle. So I'll do this sometimes. You're running on like a shared use pathway, and it has like a little yellow meridian line in the middle. Try to like run on that, right? So each of your foot strengths is landing on the line. So if I were to look at myself from behind, if I'm doing that, I'm going to be getting like a little bit of crossover each time, right? So I'm going to lose that knee window basically. You're not going to be able to kind of see that space between the knees with the runner, which is like, I don't know, fine to do for fun sometimes, but people who do this chronically, who do this all the time, if you kind of imagine if my fingertips are my hip joints, my hips are going to be more kind of towards midline or like adducted, as we say. There's going to be kind of different, if this is my knee here between my hands, it's going to sort of change the torque at the knee a little bit. Either I'm going to have a little bit of kind of like a valgus bowing in if my tibia is staying vertical, or if my tibia is kind of going along with my femur, then it's going to create a little bit of a kind of like a bending force in the tibia. If you've watched our tendon talks, you know tendons like being pulled on, they don't like being compressed. Bone is the opposite. It likes compressive load, it doesn't like tensioning. And if you kind of imagine like this is my tibia now, if it's kind of bowed one way, one side is going to be compressed, kind of the concave side of the bow, and on the convex side of the bow there's going to be kind of like a longitudinal pulling force. And that's a big risk factor for like stress fractures.
Yeah.
Basically, if you have that happening over a long period, the bones is going to be kind of breaking down faster than it can remodel, and you get like the stress fracture. So anyways, yeah, really simple to look at. You're looking kind of for that knee window. If you notice that you are missing your knee window, or if the athlete you're looking at, if their knee window has disappeared, you might cue them to think about kind of driving their knees straight forward, not letting them come in, or landing with their feet under their hips instead of under their belly button. So yeah, again, you might chalk a line on the treadmill, or you might like use one of those like meridians on the multi-use pathway and just cue them to kind of land with their feet either side instead of right at midline. So that's the other. So again, like so with our kind of from the hips with that excessive adduction, you can kind of picture that the insertion of the glute muscles relative to the IT band is going to change. That can increase your like gluteal tendonitis risk, as well as your risk of like IT band compressive or friction syndrome. Yeah, at the knee, you can kind of imagine how that increase in valgus is going to like change the load through the knee joint. We like to have a little bit more kind of medial load with running, and it's going to make your load a little more lateral. We talked about the tibia, how that bowing can lead to stress fractures, and then you can also imagine that it's going to sort of change the angle at the foot a little bit. It's going to get the foot like potentially like maybe pronating a bit more than it would otherwise. That's going to change the angle of the Achilles as it crosses the ankle joint. And anyways, it can basically cause issues up and down the chain. And again, it's kind of an easy one visually to see. So that's knee window. Those are my two corrections for your running. Overstride, which again is heel in front of the body and probably quite a bouncy run. And number two is that knee window, which is going to go along with kind of like rotation of the legs sometimes. Often people who are like overreaching are going to be kind of overreaching, coming towards midline and rotating all at the same time. So some of the fixes like speeding up your cadence can be good for both. Otherwise, if you're kind of in the overstride group, try to think about not seeing your toes as you run. You can think about like your feet landing under your body instead of ahead of you. If you're on a treadmill and you can sort of see yourself in the mirror, like watch for that head bob and simply try to kind of run smoother, less loudly and with less bounce. Those are a few kind of like visual and auditory cues to take. Again, whether you're the runner or whether you're the person evaluating the runner, either way. And then with kind of that crossover stride or that missing knee window, you can think about landing with your feet under your hips, kind of driving your legs straight forward, not crossing midline, or using something on the ground as a cue to keep your feet from landing on the same line as you run. So those
Great
are
tips.
fixes.
Great
Yeah.
tips. We got
Thanks.
rapid fire questions. We have 2 questions in like 3 minutes.
Okay.
Sorry. If you're treating someone with patellofemoral pain syndrome, are you educating them to decrease volume to be pain-free, or is a low-level baseline pain okay as long as it doesn't continually increase throughout the run?
Yeah, so PFPS, definitely like strengthen the hip, strengthen the knee. If you're a physio, like those are really important things to focus on. With any running injury, yeah, basically like you want to take your volume down, but let's say it's PFPS, let's say their pain comes on after 10 minutes of running, then it's still okay for them to keep up that 10 minutes of running. You don't want to kind of move them to that far into the curve where they're going to get kind of an increased risk of injury because their tissues are becoming too deconditioned. So yeah, back it off. If they can run a little bit without pain, fantastic. If it's kind of an immediate pain, then you might want to do a little bit of rest and then kind of as soon as possible, kind of get back into that. And rest can be like relative rest. It can mean like swimming, biking, a walking program. Yes.
No, that's a good question. Kind of answered your question as you typed it out too, Brooke, like the continually increase in pain. If that's happening, then obviously cut it off. So, good, very good question. We got one from Steven on Zoom. We'll take a minute to answer this. I was running when I was young, more of a sprinter, still have those cleats. That said, I use a treadmill during my home workouts, not barefoot but in socks. My general question is run on the foot/heel. That sounds clunky, or more on the mid to toe off the foot. Seems less impacting.
Yeah, if you're not wearing a shoe, go with the midfoot or the forefoot.
Yeah.
Definitely.
Good.
Yeah. Like a heel strike's okay. Again, if you're wearing a shoe, a heel strike's okay. More important that the foot's kind of landing under your body.
Yeah.
And you can kind of imagine too, like there's going to be less of that kind of like bouncing, jarring, braking force if the foot's landing under you, regardless of your footfall pattern.
Mm-hmm.
Yeah.
No, great.
So yeah, foot strike matters, but like where the foot's landing matters even more. But yeah, if you're going shoeless, like on a treadmill, that's a great workout. But yeah, don't bash up your heel.
Now I learned a lot during that. So it's great because being a physio is obviously really cool, but you get to work into your own interests and activities. So Rob, being a runner, can treat runners effectively, and any sports that involve running too. So there's a lot of endurance, like even soccer, when you think about it, you're moving around the whole time. So a lot of good tips from Rob. And then each physio brings their own kind of sporting or activity interest, which is great. So thank you to Rob. Maybe we'll turn this.
Thanks so much.
I know I said last time we'll turn this into a weekly thing. So I don't know if you could think of new topics every week for running.
Probably always.
Okay, good. So maybe we'll do a running thing every week. So thank you to Rob. Tomorrow we have postnatal exercise, how to get back into activity after having a kid, having a baby. So a good friend of mine and a colleague, Megan, will be with us. She's a great personal trainer and certified strength and conditioning coach, and has training on additional training on how to work with this population. So it's a great thing to do. Lots of free tips to anybody. So we'll also try to have Brittany Wade come in tomorrow too, who is the women's health physio. Great stuff, guys. I'll try these tips when I run my marathon this weekend. Okay, good job,
nice.
Evan.
Don't change if you're running a marathon this weekend.
Make sure you don't stretch and warm up. Sorry. No, you'll do fine. But call me after when you have some inflammation, stuff like that. So yes, Megan's going to be with us tomorrow, which I'm very excited about. And we'll get some more tips from her, and then maybe we'll do that as like a weekly thing, and lifting as a weekly thing. So we're kind of getting themes now, which is really cool. So join us tomorrow. Thanks a lot, guys. Peace out. Rob, do a little spin for me.
Thanks so much for tuning in.
Bye, guys. Peace out.
Matthew is teaching